Congressman Huizenga, how are you, sir? Good to have you here on Zona Política.
Buenas tardes, Helen. Necesito practicar un momento. Gracias por la oportunidad.
Qué bueno tenerlo, congresista. No estaba segura si hablaba también el español, pero es excelente.
Sabes, no hablo mucho y mi español solamente es más o menos, pero estoy aprendiendo y practicando también. So, maybe at some point I'll be able to do the entire interview in Spanish. I hope I can sometime.
I'm sure you will very soon. The vote today regarding the Affordable Care Act, and specifically what needs to change in the Affordable Care Act. One of the most important pieces, I think, is that it would restore full-time employment to the 40-hour work week.
Yes, and this is just a logical move, I believe. It's very important because this has affected people. It affected my own nephew who works in a restaurant. Back a few months ago, the management pulled everybody in and said, I'm sorry, but due to the way the law is written, nobody is going to be working over 29 hours a week.
Mm-hmm.
And he's trying to put himself through college. That meant he lost shifts. There's a number of others, including some fellow single mothers that were working there, and Hispanic gentlemen that were there as well working, and they're looking at each other saying, now what do we do? How do we go find another part-time job in a very difficult economy? And it wasn't the choice of the employer. It certainly wasn't the choice of the employees, but they've been forced into this because of this provision. So we're trying to fix that today.
Now, one of the things that will stay in place is the guarantee that those who have pre-existing conditions can still get affordable coverage.
Yes, and I think that's very important. There are a few things in Obamacare that make sense. Having people be covered for their pre-existing conditions is one of those, and I think it's very important, whether people have been battling cancer or some other disease that to no fault of their own they've been stricken with, and suddenly they're having to fight insurance companies and find doctors that are the right doctors and those kinds of things. We don't need to add to that burden, and that's something that we need to continue to do.
Also, people wonder if I'm in Florida and there's a great insurance policy in Texas, I can't buy it because I'm not living in Texas. Is there an opportunity to lift that to be able to buy insurance from within the 50 states?
Yeah, well, currently no. The law says that you cannot cross state borders. You can't, as you point out, live in Florida or live part-time in Florida and part-time in Texas or in Georgia or in Michigan. And pick where you would be able to get a better health plan. You have to pick one, and you have to be living there. And so that doesn't make a whole lot of sense to me. It doesn't make a whole lot of sense to a lot of people here, and that's one of those common sense things that we can do to change and make this program work, because it's not working now.
Well, it would certainly be a lot better because it would increase competition, and that's what's important. That's what makes this country such a great country. It levels the playing field, and if you have good competition, the better product will win, and that only occurs if you lift up this restriction.
Yeah, I think that's exactly right. And, we know that there are opportunities in other states and people can benefit from that. We just have to have the courage to be able to go do that.
And one of the things also is that people are so concerned because there are so many doctors who are so unhappy with the Affordable Care Act that they're not taking patients who are on Medicare or Medicaid. They're reducing their numbers, and some of them are even retiring. The frustration level is so high. We have an aging population. We need more doctors, and we need them to be good doctors too.
Yes, that's exactly right. And if we aren't getting doctors coming in replacing them, that's going to leave our growing population, especially younger people, and 65% of Hispanics or something along that line are between 22 and 35 years old. If 40, 50 years from now, when my kids, and I'm 45 right now, so even 20, 30 years from now, as I'm needing a doctor, and where are they going to be? We're going to have a shortage of not just doctors but nurses and others, and it's because they're being scared out of the business and out of the industry.
Well, when you look at the Affordable Care Act, it's designed so that the young and the healthy are the ones who bear the biggest brunt of the cost. Hispanic, the average age of the Hispanic in the United States is 27 years old, and not able in this economy to be able to afford what are higher premiums and very high deductibles. Congressman, we get a lot of people who call here and say, you know what, I lost my insurance and now I have to pay a higher premium and a higher deductible. And when I say higher deductible, it's in the range of $4,000 to $6,000. Yep. Now, this is what my listeners call in to tell me. That's just untenable.
Oh, absolutely. How does a hard-working family pay for gas? As we're seeing that skyrocket up, because we won't approve the Keystone pipeline and it won't allow exploration for energy in some of the other places. They're looking at increased grocery costs. They're looking at increased costs across the board, and then you add on this particular situation. In fact, I had a Hispanic young lady, a mother, come to me, and she said, "I don't know what I'm going to do because." My monthly premium is increasing, plus my deductible is increasing. It looks to me like I'm getting hit both ways, and I couldn't give her a better answer than she's right.
She is getting hit both ways. Congressman Bill Huizenga of Michigan, thanks so much, sir, for being with us today on Zona Política.
Gracias, Helen.
Hasta la próxima, congresista.